Let's talk about when to decide to sterilization, whether men should do it or women should do it. In fact, there's a lot of fundamental difference between tubal ligations and also vasectomy that is done. Fundamentally, there are three major differences. Number one is that the vasectomy is a simpler operation that can be done with local anesthesia. So when that is done, the men will experience a little bit of local anesthetic injection for the numbing of the skin, and the vasectomy itself can be done with the men completely awake. On the other hand, tubal ligation is an operation that tends to be requiring either a laparoscopic surgery or an open surgery to tie the two tubes. Imagine the actual operation itself has to go through the abdominal wall, then there's always that risk of injuring other organs. Apart from that, you also have the risk associated with general anesthesia because tubal ligation can never be done under local anesthesia. So number two fundamental difference is actually the reversibility. When a woman undergoes tubal ligation, the tube itself, it's almost impossible to be joined back together because that itself requires a complex procedure and the blood supply may prohibit the reconnections of the tube. Therefore, it is generally perceived as permanently impossible for reconnection. However, on the other hand, there is a possibility of joining back the actual vase itself. That is called vasovasostomy, or the reversal of vasectomy. Of course, if you leave it long enough, then the joining back together may not be so successful. However, failing that, there's always that option of finding one sperm in order to create a test tube baby for you. And number three, it's cost. The cost for tubal ligation is significantly higher because the woman has to be admitted to hospital, has to undergo a general anesthesia, theatre operating charges, anesthesia charges, and they all add up. However, if the guy chooses to do it, most of the time we can do it in the clinic. There's no need for a daycare, there's no need for operating theatre, and when it's done in local anesthetic room, you walk in and you walk out in no time and your cost will be significantly lower. For the following week, we want to talk about reversibility of vasectomy. Then stay tuned for next week's Putting Dr. G on the Spot.